It's pretty clear that there are not 50 Republicans at the moment to vote for a replacement for Obamacare.
My name is Joe Williams. I'm a Senate leadership reporter for Roll Call. Last night we saw two Republican senators come out in opposition to the current GOP proposal to overhaul Obamacare. Senators Mike Lee of Utah and Jerry Moran of Kansas both said that they would vote against the motion to proceed to the current proposal. That brought the total number of members opposed to the measure to 4, which is enough to prevent the chamber from being able to take it up. The majority leader then came out and said that the chamber would try to vote on a 2015 repeal bill that Congress passed and President Barack Obama vetoed.
I would remind everyone that in that proposal, there's a 2-year delay. A 2-year delay which would give us the opportunity to work out a complete replacement on a bipartisan basis with our Democratic friends.
That repeal bill would end the law's Medicaid expansion and also several other major provisions, including the subsidy payments that help individuals afford insurance after 2 years. So it is considered a much less generous proposal than the previous drafts of the insurance overhaul that Republicans had pushed.
We voted in 2015 to repeal Obamacare. I'm in favor of the motion to proceed to repealing Obamacare. And I think that's what we should do, and that's what the discussion's been about.
Today you saw 3 Republican Senators Lisa Murkowski of Alaska, Shelley Moore Capito of West Virginia, and Susan Collins of Maine all come out in opposition to that measure, meaning that Senate Majority Leader Mitch McConnell does not have the votes to proceed to that either. So it remains an open question of what exactly Republicans are going to do on health care. It seems that now the tide has turned a little bit and there is openness to work with Democrats on a bipartisan proposal.
We Democrats believe that the time has finally come for our Republican colleagues to take us up on our offer of working together to improve the healthcare system rather than sabotage it.
That'll be a heavy lift. There are serious policy divisions that exist between the two parties, and in the coming days, the coming weeks, we should see more movement on that. But first, McConnell is still dedicated to holding a vote on the motion to proceed to the House-passed bill that would overhaul Obamacare, and we should expect to see that sometime this week.